Thank you, Q. I'm Jolene Thomas from OhioMHAS, and I have the privilege of moderating the next session, which is peer support within MRSS, and it's a panel of two lovely women that have been working within MRSS as peer supporters. So I will allow each person to speak and tell their story. And then please feel free to add any questions in the chat box, and we will try to get to those at the end. If for some reason we can't get to all of the questions, we will have a question and answer period later this afternoon. So now I would like to introduce to you Kaylee Dillon from Youth Move, Ohio, and Margaret Lawrence from Coleman Health Services. And Kaylee, how about if you start us off?
Hi, everyone. I'm Kaylee Dillon. I worked as a youth peer supporter for about 2 years at Alta Care Group up in Youngstown, Ohio. I am currently working at Youth Move and assisting with curriculum development for the youth peer support in Ohio.
And Margaret?
Good morning. My name is Margaret Lawrence, and I am the Chief Officer for Coleman Professional Services, which is now Coleman Health Services. And I was going to talk this morning about our Mobile Response Stabilization Services, as well as how it involves peer support. So in the beginning, back in around 2018, we were approached by the Mental Health Board asking if we would be willing to do a mobile response stabilization service team for Allen, Auglaize, Hardin, and they also wanted us to include Putnam County. So we decided that it was vital, first of all, to find the right team members for the fact that the mobile response requires a lot of community involvement. So our team felt it was important to make sure that we understood the way it was performed in Milwaukee, New Jersey, Connecticut. We did a lot of training. The team was part of core training, treatment planning, how to work with families and resiliency. And I'll have to say my slides aren't as good as Dr. Chris, but his slides were amazing, but I will give you all that I know about MRSS. Next slide. So our MRSS team is a part-time clinician and 2 full-time peer support staff plus a supervisor. So that's what our team here in Allen, Auglaize, Hardin, and Putnam, that's the way our MRSS team is built today. One of the things that we did in order back in 2018, 2019, whenever I would talk about mobile response, individuals would ask, what does that mean? What are they going to do? How are they going to help? So we started first with the Mental Health Board, meeting with Job and Family Services, Children's Services, Family and Children First Council, Juvenile Detention Centers. And then we started getting out the marketing information, media, newspaper, social media, in order to explain what MRSS was and what MRSS was not. So the first thing, our first step was, we have a 24/7 hope line, which triages calls for us that come in 24/7. We would get information from the family to define what the family crisis or what the family event was. When the team first meets with the family, they would do just a general inquiry, just kind of getting to know the family with the clinician and the peer to see the support that the family needed. We looked at the 5 to 6 week approach with each family, and then we wanted to make sure that we had goals set for the family, and that towards the end of the 6 week marker that the family felt that they were stable or they had the resources they need in place. The next thing we did was step 5. We would do an exit plan with the team and the family to make sure that the family had what they needed and to remind them they could start another service with our mobile response stabilization team by calling our Hope line. So when we first started, which was, we finally got the team up and running around in 2019, they served 36 families. If a family didn't want the service, sometimes maybe an agency would call and they would say, I have a family, could you meet with this family? If the family didn't want the service, then we just didn't follow through. So we had 3 that did not want to follow through. Our referrals, they came through our Hope line. We had schools that would call, Family Children First Council and Juvenile Court, once they realized what the service was that Mobile Response Stabilization was offering. Some of the barriers for families that our team would hear was normally affordable housing. They met many times with families that were living in a one-room motel or hotel in town. Some of the families needed child psychiatry, and which we didn't have a lot of in the rural areas. Some was transportation, resources, food, and employment. The number of individuals who had never used a food bank or didn't know how to access a food bank was unbelievable. Sometimes I think individuals will get to the end of the month, maybe run out of money for food and don't realize that there's agencies in town that can help. We worked a lot with school and the summer programs just so that they understood what our mobile response team was. In the 36 families that allowed our team to come into their home, sometimes it was at a park, sometimes it was the family to find the home. They would share some of their intimate details to the team once they felt comfortable. Some of these families had used multiple services or were involved with systems, and they just wanted something different and someone that would hear them out. Next slide. So I'm going to give you some of our current data to date with our mobile response team. We have served over 117 individuals through our mobile response from the date of, it was back in April to current. Next slide. We have served them in the family's home. We've gone to provider agencies, and there's been a couple of times where mobile response team has been present at juvenile court, but we will work with hospitals, wherever the service is needed. We allow the family to define what that looks like. Next slide. The individual agencies, the majority of the agencies were from Children's Services. Those were a lot of our calls where they would ask us to assist a family. Maybe Johnny wasn't going to school, or Johnny had bad behaviors at home, trying to determine what was going on in the home. I know one story where our team went out to a hotel where the 17-year-old was babysitting for young siblings. Mom was working, so when he would go to school, of course he was exhausted. He was babysitting for young siblings, and here mom needed help with housing. She needed some help with parenting, which would be hard to parent when you're in a one-room hotel. We also work with school staff and court staff as well. And early on, we would attend some of our wraparound services and meetings, and then meetings with families. Next slide. 89% that they asked had Medicaid, and some of the families had private insurance. So this just kind of gives you a snapshot of the individual served. So some of the referrals that were made in MRSS, these were referrals that we would make for families. We would make referrals to maybe case management, wraparound service, the Board of Disability Development, There was some where they made referrals to equestrian therapy, medication management, school-based case management. We used SAFI, Family Resource Center, anything that would help the youth and the family, any type of supports that they could find, big brothers, big sisters, kinship, anything that they could link the family to, as long as the family wanted the assistance, they would link them. And the next slide here is just some of the referrals that we received from mental health therapy. Some of the referrals were for housing, clothing, food. I remember a time where our peer support team had said that the kids needed clothing for school, and I think it was for uniforms. So they would help get clothing for school. Job and family income services for income and financial support. Recreational support, whether it was using the YMCA or our peer drop-in center, which is Changing Seasons. Some of those individuals, the youth, needed maybe support from a group. So they would find drop-in center, which is SAFI here that we have, where the kids could participate with other kids in a drop-in center. Next slide. This is just a list of other referrals that we had also for families that just needed maybe some self-care activities, maybe just some parent peer support. Our peer support team would help families when they couldn't connect to the internet because they were doing virtual school. They would go in, they would show mom or dad how to go online, how to help their youth so that the youth was able to use the computer so that they could attend school. And then self-care activities, anything where a family could attend together. They would do some research and then assist the families with getting self-care. So for our next phase, we hope to just continue with getting the referrals from agencies and families. We continue to market our mobile response service. With our 24 crisis hotline, we will continue to encourage families to use our hotline service to call and ask for mobile response. Our goal is to expand our team. Right now with the work shortage, it's been difficult, but our goal is to expand our team so that we are able to do completely 24/7 calls for mobile response. And then to expand the community collaboration. It's been very interesting working with agencies who in the beginning were unsure of what mobile response would bring to the team. These agencies are now asking mobile response to come to the team. Next slide. What about the future? So the future, of course, we're working on sustainability and then we're following OhioMHAS. We're also working to completely define the roles for the team, like adding a case manager, along with a youth coach, our clinician, and then of course our peer support team. Some of the barriers that we've encountered over the last 2.5, 3 years, respite and residential alternatives are a need in Ohio for children at risk. And then there's not enough child psychiatry services in our area. Most families have to go out of town within an hour, hour and a half drive. So 90% of the youth and caregivers reported that they were satisfied with the services they received from MRSS. And then 80% of the families met the goals that they were set in the beginning within that 6-week period. So I just wanted to just go over a couple of quotes from some of the families. So you were the one who's been helping me with my family in a way no one else has been able to do, kind of taking a different view when working with the family. You are welcome here anytime. You've been amazing and helpful. I don't find people like you very often who truly care. And another family member, my son learned some new coping skills and how to deal with his anger. Peer support staff assisted me with building schedules for my kids so that I was more consistent with parenting. I mean, you would think it's something so simple to come up with schedules. This is the time you'll work on your homework. This is the TV time. This is the time that you'll play the PlayStation. But actually sitting down with a mom or a dad and saying, why don't you try this to see if this will work? And then a lot of communication, how to communicate as a family. I know our team spent time at parks with individuals, just with the family. That's a self-care activity, as well as just having the family communicate and work together. So one thing I wanted to just on my last few slides here is to talk about what is peer support. So when I found this website here that said peer support is the process of giving and receiving encouragement and assistance to achieve long-term recovery. Peer supporters, they offer emotional support, they share knowledge, they teach skills, they offer practical assistance, they connect people with resources, opportunities, communities of support, and other people. And I want to add, they provide hope. What is peer recovery support? So it focuses on the long-term recovery, and it's rooted in the culture of hope, health, and wellness. The focus on long-term peer recovery support goes beyond just the reduction or elimination of symptoms to encompass self-actualization, community and civic engagement, and overall wellness. They want the family to feel that they were helped and that they left them better than when they found them. And the reason that the MRSS needs peer support on a team is they can help the family feel that there is hope. They can help knock down barriers. Some of them say, these are the same barriers I had. If I can do it, you can do it. They don't feel as if any task is too small. And for Coleman Professional Services, we're blessed to have peer support staff at our agency and on our mobile response team. And that was it. So on behalf of the MRSS team at Coleman Health Services, I thank you for our time. Our team is made up of Andrew Ankney, who's the clinical supervisor, Megan Fisher, who is our MRSS clinician, and Jan Mulcahy is peer support. And I also want to add Whitney Ratliff, who also assists with clinical supervising for the team.
Hi, everyone. So Margaret just did a great job of covering peer support, especially in the MRSS system. I'm going to go over more focus on the youth peer supports and the benefits of having that in a system. So I introduced myself earlier, but I'm Kaylee Dillon. I'm the Youth Move curriculum team lead, and I've also been a certified peer supporter in the adult current curriculum for about a year. So today we're going to define youth peer support, and we're going to talk about the current state of youth peer support certification. We're going to talk about the role of youth peer support in an agency and how the agency can use youth peer support. And so then we're going to talk about peer support in a pandemic and how it has been essential to use telehealth communication and those virtual supports going through COVID. And then we're going to talk about some recommendations for youth peer supports and some final thoughts. So the Youth Move Ohio definition of youth peer support is youth peer supporters are young adults 18 to 30 who have lived experience in child and youth serving systems and may have personally experienced the challenges of coping with trauma, mental health, or substance use disorders prior to their 21st birthday. So very similar to the adult definition, there's a little bit more focus on multi-system youth and multiple different challenges that happened before the 21st birthday. So currently we're working with OhioMHAS and Corporate College to get an official youth peer support curriculum in the state of Ohio, which is really exciting. We're working on creating a whole system that has e-based, virtual, live, and in-person training modules that allow youth to get certified as youth peer supporters. Currently, the system is you get certified as an adult peer supporter, and then you can get additional training when working in youth serving agencies and working as a youth peer supporter. And this training is going to be rolling out in the beginning of January, and it's going to be piloted. So that's something to keep on everyone's radar. So again, I know Margaret sort of covered some of this. There are many different benefits of peer support and youth peer support. Peers are a critical part of the team and decrease need for hospitalization. Individuals, especially young adults and teens, respond better to peers than social workers or clinicians. It's a lot easier to talk to someone that is at your level than someone that you feel like has all the power over you. So there's a different power dynamic in play there. Youth are more likely to be open and honest with a peer. This helps identify and address issues sooner. There were several times during the course of working as a youth peer supporter in MRSS and wraparound situations where the parent or an adult would have one idea of the problem or ask the kid a question, and then you ask the kid the same question 20 minutes later in a more private environment, and it might be a completely different answer. So that can be a huge benefit of youth peer support. Peer support focuses on strengths, not weaknesses. We speak the same language. Peers may have less judgment, and we provide a role model for long-term recovery. So one of the big things people always ask is, what is the difference between adult peer support and youth peer support? It's all peer support. So one of the big differences is it's multi-system. We're youth that have been through juvenile justice, have been through foster care, have been through the different school systems of IEPs, 504 plans. And so there's a wide variety of different knowledge that comes into play with each of those systems and how the system differs in that transition period between a youth and an adult, because you reach an age where, like, between the 18 and 21, you have one foot in the youth serving systems, and then you have one foot in the adult serving systems often. So balancing that out and knowing which you need at different points is critical. In youth peer support, you're working with minors. So it's important that you recognize that there are different risks and liabilities. And I know it's super important to have a great supervisor you can talk through for all the legal issues that come into play. Parents and families. So youth peer supporters also work with parents and navigate that line between parents and kids, because the youth is who we're here for, but we also, because they are a youth, you have to know what the parent is wanting out of the youth peer support and how to sort of compromise and get the best of both worlds. Culture, youth peer supports are under 30, bridging the gap between youth and adult culture. I know as teens, like, we'll spend all day on our phones and we'll spend it texting. We won't necessarily call. And so there's that just just a fun little difference there. And then there are lots of system specific services like Bridges, Chafee, OhioMHAS, Engage, Systems of Care, Wraparound, MRSS, that are focused on the youth and just knowing who qualifies for those services and what's necessarily needed at specific times. So the role of a youth peer supporter in an agency can be varied. I'm going to talk about some of my specific experiences at Alta. So you have the traditional peer supporter role where you meet an individual where they're at, whether that be a home, a restaurant, a park, and you can give peer support and let them self-direct some goals and work through issues in that setting. And then you can also do that in group settings. Oftentimes I would be in the schools, and in the schools I could either do that on an individual basis or we would run groups for, I know one I did for a while was teen pregnancy. And so there are groups like that that we can go into schools and help assist with those and run those. We can also be in groups such as, I know Margaret mentioned TIPS earlier. We can assist therapists and other people in our agency that are running different groups and serve as that peer that understands like, oh, I don't know how to cook this meal. And so it can be a great learning experience for everyone involved. Another way that we can be utilized in an agency is in that more respite type role. And I know oftentimes we were utilized as that sort of backup in our agency. And so that can be a great way that youth peer supporters can also operate in an agency. So I'm now going to go over some recommended steps to implementing youth peer support. So the first one is establish expectations and purpose. So you work with agency leadership and staff to establish understanding and expectation for youth leaders. Understand and ask key questions. Why do we want youth in our agency? What will their role be? How are we going to support them? What is our budget? Will they work as a team? Are we willing to invest in this work? How will we utilize their voices and expertise? And complete an agency readiness plan. So these questions are really important because oftentimes you want to make sure that everyone's aware of the role of a youth peer supporter in a program, and you're not just the last person that gets a spot at the table. And so it's really important that everyone knows what their role is and how they're going to be part of a team. I know I had bosses that were really good at advocating when there were team meetings on clients that everyone was at the table. And so that can be really key. 2 is understanding culture, youth culture, family culture, values and experiences, systems culture, recognize and identify agency culture, culture of poverty, and influences on culture, including poverty, trauma, and transition. So every agency has its culture, and it's important to know where your agency culture and all these other cultures overlap and how to make sure that everyone's getting what they need and is having their values and experience recognized. Three is provide opportunities. So include youth in agency trainings and events, include youth in meetings at all levels as appropriate, invite youth to share their insights and give feedback into policies and programs, give youth opportunities to share new and creative ideas and solutions, give youth opportunities to help set agendas and develop agency goals, empower youth to use their lived experience to help improve systems and programs, give youth opportunities to speak at events, give youth opportunities to present or co-present in trainings, give youth opportunities to create new programs and manage projects, give youth voice on grants or special initiatives. So I know one of those things is occurring right now. Thank you, OhioMHAS, for letting me speak at this event today. It's very important that we're being provided the opportunity to not only give feedback, but also be able to help shape initiatives. And so that's something that is really cool that has come out of this pandemic that I'm going to talk about soon, is just creating new ways to connect in telehealth and in peer support roles virtually. And so there's a lot of importance in letting us be a stakeholder at the table and not just having us there. And so that's basically what this slide is saying. Provide support. So a big part of peer support in general is authentic relationships, building trust, remembering that peers have lived experience, helping watch and manage trauma triggers, provide multiple levels of support, designate a mentor, have regular supervisions, provide peer groups, help identify and remove personal barriers to success, create open conversations and open door policies, create a safe space to vent and ask questions, provide ongoing opportunities for training, networking, and growth. So I believe the keynote was talking a little bit about the importance of being able to do all of this and being authentic in relationships and just that empathy and knowing that there is that experience there. So another thing we've been talking about a lot as we're developing curriculum is watching and managing trauma triggers. We have this saying that it's going to happen, and working as a peer supporter, like especially as a youth peer supporter, we're newer in our recovery a lot of times. And so it's important that our supervisors are aware and can ask us about our self-care and really have that self-care piece built in to the supervision. I know it was really helpful at Alta. We would meet one-on-one with our supervisors, but we would also have group meetings where we would talk through difficult things, whether it was something that was personally difficult for us or something that we needed more of a brainstorming environment for. And so I know we're working on with the youth peer support curriculum, there's going to be group coaching sessions so that even if there's only like 1 or 2 youth in an agency, that everyone is able to get support from other youth. So that's something to keep in mind. So this is just kind of a wrap up of the past 4 slides. It's important to be genuine and honest, establish authentic relationships, build trust, respect young people as partners in identifying needs and developing programs and initiatives. Youth will be more successful in services if they have a voice in developing and implementing the services. Youth can influence their peers and help programs succeed. Incorporating youth into the process will help you to develop a strongly culturally competent program. Valuing a new perspective at the table can help your agency be more successful. and recognize youth are key stakeholders. So one of the things I talked about a little bit earlier was supporting youth on initiatives. And so I know something that we've been really excited that has come out of this pandemic is we've started working on an app for youth peer support. And this has really been driven by the youth at Youth Move. So we're working on having a public side of this app that connects people to a variety of different resources that just helps them to initially get connected with services, as well as has some self-guided activities for mindfulness and things that can help in the moment. And then we're going to have a private side that allows peer supporters to connect with their person that's receiving services. And it's going to be on a HIPAA compliant side that basically allows communication through video call, texting. And so if, like, say someone's in a rural area and doesn't have access to be able to drive somewhere, that they can still be able to get connection when they need with a peer supporter. So that's something we're really excited about that should be coming out fairly soon. So additional recommendations for youth peer support is just making sure that agencies have a readiness assessment. They know how youth are going to be involved in their agency and knowing how they're going to participate in like an MRSS team. So certification of agencies sort of in that readiness assessment, specialized training for supervisors, and as part of the workforce continuum, a path to train youth peer supporters to be supervisors, because that's going to become more important as we get down the line with this youth curriculum. And then we're currently working with OhioMHAS for the Medicaid billable ruling. So I know a couple of you have seen this quote before. You're never too small to make a difference, Greta Thunberg. And so the quote's just really important because anyone can make a difference, and it doesn't matter how you necessarily feel, you can make a difference. So that's the quote I'm going to leave you all with today. And you can reach us at Youth Move.
Thank you, Kaylee and Margaret. We do have a few questions in the chat box, but I just wanted to emphasize the role that peer support plays in both MRSS and in other systems of care. Margaret and Kaylee really highlighted the need for peer support and the uniqueness of that role. So I just wanted to ask both of you some organizations do not employ peer supporters, whether it's youth or adult or family. What advice would you give them? What words of encouragement would you give them if they're still hesitant about hiring peer supporters?
So I would say, I can see 3 of the folks from Coleman on this video right now. And if I could ask one of them to speak, because if I speak, I will go on forever as to the amazing things that they have done. They bring such a different view. And if I can say, 5 years ago, when we first started a peer support team, I remember individuals saying, well, they're not clinical. They shouldn't be at the table. They're not clinical. And now they are being asked to be at every table, every meeting, every event. So I could probably go on forever, but I see Jan, and if Jan could speak for just a moment, if she doesn't mind. of why it's important?
Sure. I think that the relationship and the rapport building that you, when you engage right at first is so important. When they figure out that you're not from Children's Services or you're not the law, and that you're speaking in their language and you have the same lingo. I think that's one of the biggest positive things that to build that rapport. I can remember Rick Shepler telling me one time, thank you, Jan, for just keeping it real. And, you know, like we'll have something, we had somebody with taking the doors off of their kids' bedrooms. And then the kids were playing their music and they said that they play the music too loud. So we got the kid a set of headphones and problem solved for that. For that particular family. It was just something very simple that we had probably experienced in our own homes at one time. But the peer support is speaking their language. I really do believe that it's speaking their language and showing them that there's hope on the other side. I've been in your shoes. You will not remember this case manager's name years from now. This is going to get resolved, and this is how you do it. So just holding their hand. I go to food pantries with them. I stand in line with them. Just get them through that first time. And then they start doing things on their own. And that's when they really feel the independence come to them.
Thank you.
Mm-hmm.
I don't know, Margaret, if there was anyone else from Coleman that would like to make a comment or.
Tammy Gould, would you like to say anything?
Yes, I would. On the account of peer, I'd just like to share that I'm in long-term recovery, and Jan was my recovery coach. So she was a peer to me, and just watching her help me do everything that she's already been through, it was easier to talk to Jan because I knew Jan had already been there. And she just didn't read it out of a book. So helping out with the MRSS team and like all the things that I've been through, this is my first meeting sitting in. And I am so excited to be a part of help a family unit. Like just have that person to say, wow, you know what I'm going through. That means more than a lot of people realize.
Thank you, Tammy. Kaylee, did you have any words of advice for someone that may still not be real sure about hiring peer supporters?
I just think the most important thing about peer support is that we've been there, and not necessarily we've been in their exact same shoes, but we've been in a similar situation and we have come out on the other side. And so I think the thing I would tell agencies is that peer supporters are worth it. They know the system, they've lived through it, and we want to be able to give back. Like it's something really special to be able to give back to our peers and just use the experience that we've had to help others. And so I think we're a valuable asset that people should want because we want to help and we have the experience too.
Thank you, Kaylee. So some of the questions from Sarah Becker asks, many agencies are worried about how to best support peers when they don't have a peer support supervisor with lived experience. Any suggestions?
I would suggest to go through some of the training. I don't have a lived experience, but the training that is offered in order for me to understand how to work with peers has been very valuable. And I have a couple other directors on my team that have gone through the training as well. So I would say start with finding out what training will be helpful for you to understand how to work with peers.
Thank
I'm
you.
going-
Go ahead, Kaylee.
Yeah, I'm gonna add, just be open to dialogue. I know, I'm gonna brag on Chris for a second up at Alta. But she has gone through all the training, and so she understands, but we also have different sets of lived experience. So not everyone's gonna have the same lived experience, and be open to trying to understand and asking questions to help clarify things that you don't understand, and just have that open dialogue. Like, I think that's the most important thing with a supervisor of peer support, is being able to have that conversation.
Thank you, Kaylee. Let's see what else. I know there was a question.
There's a Medicaid question on here, Jolene. This is Wilma.
Okay. Do
Can
wanna
you hear
take
me?
that?
Yeah, I will.
Okay.
Just for everybody to know, the question is, will Medicaid change its stance on permitting organization to bill for peer support for mental health and not just SUD diagnosis? Currently, billing is only permitted for SUD. Yes and no. The yes part is that for MRSS, as part of Medicaid rule and OhioMHAS rule for MRSS, we've built in for parent and young adult peer support to be Medicaid billable, whether the person mental health and co-caring. They are not opening the door for all services within your agencies, though. It's just certain services. IHBT, same thing. You will be able to bill for peer support under it, ACT. And I'm not going to name, there's 5 of them now. The question has been asked of them, will they consider changing this rule? And they say right now it's too much on their plate, maybe down the road. So we need to keep pushing for Medicaid to make that change for all services. As well as, if you look at that Ohio Rides website, you can see the rates. And Kelly said it yesterday in the presentation. It's built in the rate that they will pay for peer supporters as well. So the answer is yes and no. For certain services, yes. For all services, no. Okay.
Thanks, Wilma. There are a few other questions regarding texting with clients. Let me see. And how to ensure that it's HIPAA compliant. Excuse me. Tamara O'Brien, did you want to unmute yourself and ask that question?
Yes.
Thank you.
Well, I noticed that someone else had asked a question about how do you incorporate it into the record if you need to. And, you know, I do agree that texting is important, especially with youth. But that's been our concern. We don't have our own phones. I mean, we use our own phones. We don't have phones necessarily from work. So there's some concern too about use of phones, but then how to make sure the record reflects the communication. So any suggestions or tips that way from people?
I know, just making sure that it's documented, because like oftentimes when you're texting, when I was texting back and forth, I know it would be like 15, 20 minutes of communication back and forth. And so just making sure that that's documented, that, oh, we had a text conversation about XYZ. And so I know that's how it was often documented for me.
Did you use your own phone, Kelly?
Yes, yes. And I know that's one of the things we're really looking forward to about this virtual app that's coming out, is it is going to be HIPAA compliant on that peer support side. And so you'll be able to message and call on that without having to use your personal number. So that should be coming out.
I would say you're
Hopefully.
working, you should say you're working towards
Yeah,
it being HIPAA
hopefully soon.
compliant.
It's getting there.
No,
but-
not just as coming out. Hopefully, you have to go through the whole process of it becoming HIPAA compliant.
Yes.
Mhm.
Thank you.
Thank you.
Kathleen Burkhardt, excuse me, put a note in here about something called dial pad. I think that's in response to the texting question. Kathleen, do you want to unmute yourself? And
Sure. We use dial pad, which is a technology you can have just one phone, but you have a separate phone number. And for each line, it's about anywhere between $20 and $30 a month. And it actually records separate from your own personal texting and things. It's just a separate app. You can link it to your work email, and you and your supervisor or anyone can see what was said in the text, you know, date, time. And also if there's a phone call, it does a voice recording, voice to text recording. So you can get a pretty good gist. It's not always accurate, but a pretty good gist of what was said during a phone call as well. So we really like that technology here. I'm the only one currently using it, you know, in my agency, but we just launched our program a few months ago. So I like it. It helps for documentation and it's secure and safe. I would say it's HIPAA compliant. But I've really, myself and the executive director where I work, we really like that program, and it's, you know, inexpensive.
And there's a website that we can look at and read more about it, Kathleen?
Yes, you can go just right to dial pad, and it was recommended to me during my FREDLA training from one of the trainers. So that's what they used, and yeah, we really like it. And we like the fact that we don't have to have two separate phones. You know, kind of weird when you walk into someone's house and you have two separate phones. You know, if you have one phone, I don't know, just like that.
thank you, Kathleen.
Yeah.
Did anybody else have any more questions for Kaylee or Margaret or any of the other peer supporters that are on this call? No? Okay. Well, just a reminder that, whoops, there's one new message. Okay, Laura just put in the chat box that there will be a link to the SurveyMonkey that you'll need to complete after this session if you need to get CEUs. And Matt Weiland also just added the link to dial pad in the message box in case anyone didn't see it and you're interested in that, looking up and getting more information on that. I know we will be having a 15-minute break after this session, but let's see, Lisa or Leslie, excuse me, Riddenball just added that all of our staff have Google Voice, and it provides a local phone number with text and calling voicemail capabilities. We allow our clients to sign an encryption waiver if they wish to communicate via text or email. So all of these are really good examples of how you can use text with your clients and it be protected. Thank you, Leslie. Okay, I will turn it over to Laura or Rick.
Thank you, Jolene. Yes, we are moving into a 15-minute break, or I guess we have a couple extra minutes here, but please plan to be back at 11:15 a.m. for our next session.